Do you want to know how to balance autonomic nervous system function through effective needle placement, bracketing, and frequency selection? If so, you'll probably want to stick around because in this episode, I will explain why and how you should implement protocols to help your patients get into a deep parasympathetic healing state. My name is Dr. Jeremy, and I help acupuncturists like you create breakthrough patient results with the world's most cutting-edge electroacupuncture techniques. If you're not already subscribed, click the subscribe button now. This way, you can receive a notification each time I release a new training episode. I give away a free downloadable training resource along with each video and blog. This episode is called Quick Guide for Balancing the Autonomic Nervous System with Size 16 and T5. So don't forget to download this. Let's dive right in.
Machine. I still want to do other treatments. I want to balance the autonomic nervous system, and I'm going to choose small intestine 16 for that, which is the posterior border of the SCM muscle. I'll show you that right now. Now, do you do blood electric at home?
I do.
Okay, she does do blood electric at home because I need two needles, right? So one is small intestine 16. And since she does the blood electric at home, I don't need to do that for her. The other one, I could use triple energizer 5, which is another major autonomic nervous system point. Are you righty or lefty?
I'm righty.
She's a righty. You want to do non-dominant side, triple energizer 5. But let's look at this surface. Okay. Can you come around this way? And then focus on this area. Okay. So you divide the neck into top and bottom, front and back. Small intestine 16 should be right in the center, but on the posterior border of the SCM, and it's a shallow insertion, quarterson, eighthson insertion. See, the SCM muscle is a major parasympathetic muscle. So just by charging that up, you get pretty good effects with the autonomic nervous system. And then we're going to do triple energizer 5. On the non-dominant side, so her left. Are you comfortable?
Yeah.
So make sure your patient's comfortable. It's super important. And never treat in prone position. I'll tell you why in a second. Okay. So you're going to pretend that these are lower voltage devices like an Ito, Pantheon, AWQ. Okay? And remember what I said. One should be a carrier frequency and one should be a treatment frequency when you're using the lower voltage devices. And I have a slide, but for now, I like to do carrier treatment, treatment carrier. Does that make sense? So like this needle would be one frequency, this needle would be another frequency. This needle would be one frequency, this needle would be another frequency. And then the others, I don't really care about. For a lower voltage device, I'm just going to use the electricity at whatever frequencies they are. So let's hook this up and see how it goes. Yes. For a bracket, that's correct. Her question was, if I were demoing a higher voltage bracket, I would call one needle a bracket.
What would you?
So when you're in the higher voltage, you just choose two. It doesn't really matter, but I am going to show you why I prefer 73 and 4.6 for brackets. So I do wish I had a lower voltage machine, but I don't. But this is the bracket that I would do for a lower voltage machine. But as you can see, we're dedicating 4 needles to the bracket and then 2 needles, so 6 needles total, whereas if we're using, if I'm demoing it as a higher voltage bracket, then it's only 2 needles dedicated to a bracket and 2 needles for the auxiliary treatments. Okay, I'm just going to turn this on and get you started here. And I am choosing 73 hertz because remember, it turns off sympathetic signaling. It's GABA-related frequency. And we said that pain is a sympathetic lockup, and she's sympathetic. We'll get it next time, Jeff. I'm talking to the person in my ear. And then the other frequency. So I'm dialing in the frequencies as a high voltage machine because that's what they are. But you should know if I had Itos and I was demoing this, I would be carrier, like I keep telling you, 500 hertz or the fastest frequency, and treatment, 1 hertz for the beta endorphins. This machine I have set 4.6 for the beta endorphins, ACTH. This machine I have set to 73 to turn off sympathetic signaling. And the way I have machines set up are only for 4 needles. That's why I'm having trouble hooking these other 2 up. Does that make sense? Okay. Tell me when you feel a buzzy, tingly sensation. Is it light, moderate, or heavy?
Light.
Okay. And then tell me when you feel a tapping sensation or a different new place. Nothing. Okay. Is it light? Comfortable, yeah? Okay. And I just hit 20-minute timer, right? We are good to go. Timer set. Now let's talk about it. That last one?
Yeah.
So, how about now? Is it going down or it's the other one? It's the other one?
Yeah.
That's good there?
Yeah.
Okay, let me know if it gets uncomfortable. Remember, give your patient a bell or some way to get a hold of you if you run out of the room so that you can come back in and make the patient comfortable. It's super important that they're comfortable.
So what did you think? Feel free to place your comments or questions below. Now remember, I created this great downloadable resource. The link will be in the description area. Be sure to grab that. Now, I hope you enjoyed this episode. If you did, click the like button, and if you have any colleagues that would benefit from this information, feel free to share the link with them. And for further information regarding my classes, you can visit electroacupunctureinstitute.com. If you wish to attend my free training called Discover the Secret to Boosting Cellular Regeneration, Reversing Tough Disease and Restoring Lasting Health in your patients with the power of electricity, click the registration link near this video. I'll see you next time.